So casualty came out number 1 amongst all the hospitals, amongst the departments in competing hospitals. So we also came out as best practice in 5S Kaizen. The hospital has greatly improved, and even our health workers, they really appreciate the purpose of the 5S quality management skills. Otherwise, those are the most of the, and for interest sake to improve cleanliness in the hospital, we are also continuously engaging in First Friday clean-up campaign of the hospital, and tomorrow we'll also be there doing the clean-up for the hospital. The first feedback that we get from the clients, they come in with a negative attitude towards the public institution, but when they come, we also go as public relations to get some client satisfaction feedback, and most of them, they say, oh, when we came here, we thought we are going to a West Coast public institution, but we are surprised. It's like a private institution. The floors are clean, the nurses are happy, they are cheerful, and they receive you so fast and attend to you immediately. So that's one of the positive areas that we have. And the health workers in the wards, they are happy. When they come to duty, they just make sure that they find everything in place and they don't run around. Long back, we used to run around looking for something, but these days they just pick the item from its stipulated place, and easy to get, easy to return. There is a quick Kaizen and a Kaizen with a QC story. The quick Kaizen is the 5S, whereby it's called to be a quick one because you quickly create a conducive environment. You set your things, you want to see these files in this place, these chairs in this place, and these laptops or everything in this place. So that's how we say it's a quick. We quickly sort, set, shine, standardize, and sustain to create an environment where you can work easily without running around or looking around for anything. That's the quick Kaizen. Then the Kaizen with the QC story, that's the one which we find problems in our own department. There's no one who is going to come and tell us that we have a problem. We find our own problems, we find how we can manage it, the solutions, how are we going to action it. It has 7 steps. So the steps, we have to do them gradually. Yeah, the morale is difficult to boost, but when you go to a department, they will say how the work is now is. Maybe you can witness that as we go to the departments. If you could allow us to go to the 2 departments.
It's very high, especially after having started the 5S activities and all areas which pertains to quality.
As for me, we are very happy with the quality using the 5S. Our work very easy because it's like everything so very efficient in discharging our duties.
And how has been the feedback from your patients?
We've received a lot of feedback from our patients. They were saying that the quality care that we are receiving here is amazing because they were not expecting that type of quality. They were expecting that quality from maybe like private hospitals. But some they realized that they are really appreciating the service and quality.
As our sister in charge was saying, our work has become very easy because everything will be easy to reach out to. Everything will be clearly labeled and in order. So even in emergency cases, we won't be loitering around looking for items to use. It's just easy to access our items. So we are very happy that they introduced this quality.